Welcome into Queen City News Plus. I'm Derek Dellinger. June is Men's Health Month, and when you think about men's health, a lot of it has to do, quite frankly, and sometimes has to do with hesitancy, but also has to do with various other ailments that are specific to men. And today, we do have one guest to help us out with some of the questions that we have here, and some of them might be some of the more obvious questions, some of them might not be. We have Dr. Patrick Ryan here. He's with Piedmont Medical Center. Thanks so much for joining us today, Dr. Ryan. And the first question I have for you probably is arguably the most vague, but also the most expansive. What do you think is up with men's hesitancy when they go to the doctor's office? Because it's a stereotype, but it is a thing.
Well, I think it has a lot to do with control. Men generally like to feel like they're in control of things that are going on, and they like to fix things. And really, when you go to the doctor, you lose all the control. And as a physician myself, I can tell you that I don't always like going to the doctor either. But as I tell all of my patients, it's just like when your car, or just like when you have a car, you get the oil change sometimes. You just don't take it to the mechanic when it's broken down. So these routine checkups are very important just to make sure, because you only have one heart, one mind, one body. So we have to take care of it as best we can.
Frankly, in general here, have you heard any classic excuses from people about why they haven't gone to the doctor? Does it have to do with control, or are there other factors that people may bring up to you as to why they've held off possibly going to a doctor's office for years?
Well, a lot of times it's I don't want to get into the system, or it's going to get better on its own, or it's always been this way. Those are some of the prototypical things that we hear. And even something small, it's better off if you deal with something when it's small instead of when it gets large.
I'm going to kind of use myself as an example here, because there was an extended period of time where I didn't go to a doctor myself. I started doing this in my 40s, though. When I turned 40, I was like, you know what? It's probably going to be a good idea because I know I'm not going to be living forever. I might as well go ahead and just make some changes to my life to go ahead and do this. But for me, I one of my excuses was sometimes the cost associated with healthcare, or the preventative care can sometimes be a little bit. It's a little too intrusive, shall we say, sometimes with the questions and things like that. Is that something that you normally find as well?
It's something that if you have a good relationship with your provider, that one of the things that we try to do is make things be comfortable, because we know that we're going to ask some pretty sensitive questions, and have a truthful and honest relationship. So that way we could be partners in getting to the bottom of anything that's going on, or making sure that nothing's going on at all. And to me, there's no concern that's too small. If it's a concern for you, it's a concern for me, and I want to make sure that it's properly addressed.
One of the big things, and I'm going to read off a list here, big things that men have to be worried about. This is from the CDC. The brain health, cancer, cerebrovascular diseases like stroke or an aneurysm or brain bleed, chronic liver disease and cirrhosis, lower respiratory diseases, COVID-19 also a major thing as well, especially these days. Diabetes, heart disease, kidney disease, as well as potential for mental health issues and unintentional injuries. In general, is there really a classic case that you see come in? Is there an average case that involves men's health that you see that people might need to know about? As far as I know everyone's probably a little bit unique, but is there a classic ailment that's kind of associated with men that when they come into the doctor's office?
Especially with men, the biggest thing is prostate health. As we get older, our prostate gets bigger anyway, and the old joke is you can't write your name in the snow anymore. And so that goes along with urinary hesitancy, urgency, incomplete bladder emptying. The prototypical man likes to drive all the way to the beach without making a stop, or things like that. But then all of a sudden you find yourself, well, hey, every hour or so I have the urge to go to the restroom, and the stream is not as strong as what it used to be. There's a little dribbling at the end, and men really don't like to talk about things like that. But it's also a really important thing, because when treated early, we can keep small problems small. And even more importantly, some things like that can actually turn into cancer. And there are some forms of aggressive prostate cancer out there that men early in their 40s are passing away of.
Do you find that men, especially when it involves urinary health or anything involving urology, potentially involving the prostate, potentially involving any area, shall we say, below the waist, do you think that they are sometimes hesitant to even tell you exactly what's going on?
Yes. So sometimes you have to drag it out, because nobody wants to talk about or seem less manly than what they were when they were 21, but none of us are 21 anymore. And so it's important that we we have open and honest communication. So especially if things like you're feeling not in the mood, or you're feeling in the mood, but things don't work as well as what they used to. And a lot of people just say that's normal aging, but a lot of times it's not. And that's something that, we've heard it all before. I promise you that you're not going to go to your provider and tell us something that we haven't heard before when it comes to anything below the waist. And we just want to be helpful for you throughout the whole process and be a partner and help get you through whatever is going on.
And I was going to bring this up later, but it seems like a good place to talk about this now, the exam uncomfortability, especially involving I mean, there's the check for hernias. There is also the check for the prostate health. And for lack of better words, for many men, it may be considered, shall we say, a sensitive subject, shall we say, and it's something that they don't necessarily want to do. How do doctors in general try to get over that uncomfortability with it? Because I know there's A, the stigma, but also B, there's also the sense of, hey, you kind of need to get over this for the sake of your own health. The steps that need to be taken to basically get over that uncomfortability. How do you introduce that even?
Well, the biggest thing is you're completely transparent with what's going on. And we always used to joke, don't touch somebody without telling them. That's true for male or females down there, because you don't want any surprises with what's going on. The other thing as a physician is to be honest, like, this is not going to be comfortable, but we'll do it as quick as what we can, and we'll make it as painless as what we can. But, there will probably be some discomfort associated with this. The other thing is make sure you say what you're looking for. Set the expectations. When you're looking for a hernia, say sometimes you might not feel it unless you do this specific maneuver and you can't quite get the right angle. Or when you're doing a prostate exam, say, hey, where it sits, this is really the only way to get to it. And so we'll make it as painless as what we can. And I think just setting expectations, normalizing things as much as what you can, because it's not a pleasant experience to undergo those things. But at the end of the day, you also know that it's worthwhile to make sure and be reassured that there is nothing going on down there.
And from below the waist to above the waist, the issues that, shall we say, involving kidneys, as well as the lower respiratory diseases, things of that nature, that can also be a bit of an issue too. I would imagine people, men in general, probably are a little bit more aware and more willing to actually have some discussions about what's going on as far as any pain that they might be feeling, any easiness they might be feeling, if it even comes down to anything from stroke, but also any issues involving any of the organs in the torso. Tell me a little bit about that. As far as do you find that when it doesn't necessarily involve issues, shall we say, below the waist, above the waist issues, are they a little bit more upfront about?
They're a little bit more upfront, but generally the most common complaint in any physician's office is, my wife made me come. And so generally there's an external motivation making them even come and talk about it. And anytime you see that, you really have to say, okay, what's going on and what is your level of concern? Because obviously if it's been extrinsic enough for someone else to be concerned about it, men do tend to downplay their symptoms. And not be quite as forthcoming and honest, because it's this will get better on its own, or, hey, I've had this since high school, or this is just my new normal. And most commonly, especially a lot of things like people with hernias, they didn't realize that they were even hurting, and they didn't realize how bad they felt until things are fixed. So it's really important to establish a very comfortable environment where there's going to be open, honest communication about things, which also, as most wives will say, men are not very good at either. So it's really, you have to establish that environment.
Okay, we'll have more with Dr. Ryan right after this. And Dr. Ryan, there are also some ailments that people might need to be worried about as well, that they might not necessarily want to get checked, at least as it were, until, and some of these ailments might not necessarily be checked until later stages. What are the ailments, shall we say, the afflictions that people might have, that men might have, that are often not necessarily missed, shall we say, by doctors, but are not necessarily checked until the person goes in the doctor's office, that might show up later in life?
Well, one of the main risks for men is cardiovascular health. And my rule with blood vessels is we have blood vessels everywhere. So if you have high risk factors to have a heart attack, you also have high risk factors to have a stroke. And neither thing are things that you want. And men are at the highest risk for that. And in preventative care, we routinely check that. But unfortunately, unless you get checked to see what your cholesterol is, you're not going to know what your cholesterol number is. And by the time you feel bad from a heart issue or a brain issue, the damage is already done. Other issues like diabetes can be asymptomatic until they're pretty far down the line. And diabetics, actually, their most common presentation as a new diagnosis is with a heart attack or a stroke. And by then, you already have other organ systems damaged. So that's why preventative maintenance, the routine blood work that may seem routine because that's what the doctor says is routine, really it's not. Because what's routine for us as doctors that we see 20 patients a day is not routine for a patient who maybe sees a doctor once every 3 months or once a year or once every 10 or 15 years, depending on the situation.
I'll put it to you this way. Let's put it into age groups here. If you're between the ages of 18 and 30, as far as the things that you need to be worried about ailment-wise, if you had someone between that age range, what would you be watching out for as far as potential medical complications?
So the big thing for young men in particular that I worry about is actually they're at the highest risk for testicular cancer. So it's very important that they do self-checks, just like women self-check their breast monthly. Young men especially should be doing self-testicular exams once a month. And really, if you feel anything abnormal down there, or if you're not sure what it is, it's 100% of the time better to get it checked out than to not get it checked out. There are world-class athletes who had metastasis to the brain from testicular cancer at an early age that were only found out because they noticed a lump there that they didn't notice before.
As far as those between the ages of 30 and 49, I guess is probably the best way to say there. Around that age range, what do you need to be worried about?
So it's 30 and 49, my big concerns really are early risk factors for cardiovascular disease, but also your risk of colon cancer begins to increase, especially in your early 40s. We've had several famous people, it seems like in the last 5 years or so, be diagnosed with metastatic colon cancer at an early age. So anytime you notice a change in your bowels, we all have bowel habits and we all tend to stick with them. But if all of a sudden something changes, it's dark, it's red, it's painful, all of a sudden your stool starts looking like a pencil, it's thinner, all of that stuff needs checked out because the risk of be something bad is real, especially in that age group.
And as far as those 50 plus, what do they need to be worried about? Or if someone's approaching, shall we say, that age range, and they want to know exactly what's going to be happening there or what they need to be checked out for, what's that?
So especially in the 50 plus age group, again, we should be doing routine colonoscopies and getting screened for colon cancer. You should also be having your prostate checked on a regular basis. Pay attention to your symptoms. There's also this is also the time when your hormones begin to change too. Men also go through a decrease in testosterone, just like women go through menopause. And so because of that, things like erectile dysfunction can pop up, especially cardiovascular disease can also play a role in erectile dysfunction. So really, you start paying attention to your body as a whole from your head to your toe. So silly little things you might not pay attention to, like you're losing a patch of hair on your leg, make sure that you have bad blood vessels. But we're not going to know about that unless you're really paying attention to it. If all of a sudden you can't walk up a flight of stairs anymore without getting short of breath, or you're more fatigued, and you may say, oh, this is just getting older. Sometimes there is normal things with aging, but a lot of times what we find is that people blow off things that are really could be dealt with and treated, but by the time they get to it, things are much more advanced.
And when we talk about age ranges, we should also probably bring in other demographics as well. There are certain afflictions and medical issues that do affect minority communities, certain minority communities more than others. Can you talk about that a little bit?
Yeah, so there's especially our Hispanic population, they're more prone to things like diabetes, which can be very silent until all of a sudden they do have a heart attack or stroke. So that becomes very important. And that's an easy screen. You can even do it with as simple as a urine test and simple blood work. In our African-American population, colon cancer and some prostate issues also tend to pop up in that age group at an earlier age, as well as hypertension, which itself is a risk factor for having a heart attack or a stroke. And again, by the time you notice anything wrong from hypertension, it's because you've had a heart attack or a stroke and it's too late.
And we will have more from Dr. Ryan after this. And Dr. Ryan, we've talked about various parts of the body, but one of the more important things is the head when it comes to mental health, when it comes to brain health in general. And let's first touch on mental health. How much is mental health a part of what you do?
Mental health is super important, especially in primary care. And men tend to downplay symptoms more than anybody else. A lot of times again, we're not great communicators. We don't do a great job of expressing our emotions, and we tend to hold things in a little bit more. But we're just as prone to anxiety and depression and the stresses of the world, especially in this day and age where men are the prototypical caregivers. And with inflation and the price of things and the stresses of just the world these days, men feel under increased pressure. And men don't really have an outlet. And so they tend to turn to alcohol and other vices to try to get through things. And that's not a healthy way to deal with it. So one of the routine questions that most primary care providers ask is, what are the healthy ways that you deal with things? Because we all have stress. Doesn't mean that your anxiety needs medication or you're feeling down in the dumps means that somebody's going to try to write you a pill. It just means that, how do you deal with it? What are the healthy ways to do with it? What are the healthy ways to do things? And if we do start seeing problems, like if you're having problems with your sleep or not being interested in things or decreased energy level, those are the types of things what starts affecting your daily life, where we do start to broach that subject of pharmacotherapy with medicines, maybe talking to a therapist. And that's another thing that men really don't like to do. But it's also the most important thing, because as you're really going through life, the most important thing is your attitude towards life and to everything around you. And so as a primary care person, it is very important that we address those issues as well. And some things are normal and some things are not, but we want to keep things normal as much as what we can instead of into the abnormal category with an unhealthy response.
We know that, especially in the past decade or two, there's been a focus on men's mental health and also to basically erase any kind of stigma that's associated with things like depression, anxiety disorders, things of that nature. The work has been put out there, but and I would imagine people have probably become more upfront about what's going on with them. But do you still see that hesitancy? Because it's like one of those things where, hey, it's an uncomfortable thing to talk about, especially, and it kind of reminds me of those issues we were talking about just a few minutes ago with issues below the waist. It's something that they don't really want to discuss, and how it's worth noting though. Has that become? Do you find more people are willing to talk about their mental health these days rather than some issues in other parts of their body?
Yeah, I mean, I've been a physician for 20 years, and I could say in the last 2 decades that I have seen a change in the willingness that men are to admit that they're having issues. And especially, it goes back to cultivating the environment of being comfortable to be able to talk about these things and to know that your provider is truly your partner throughout all of this. I'm not going to go talk to your wife or your spouse or your significant other about your issues. We're going to work through this together. If we need to start medications, we're going to talk about the good, the bad, the ugly of all the things that goes along with that, what to expect, what are the side effects. But the most important thing is to develop healthy ways to be able to do that. And that's one of the things why doctors are always talking about diet and exercise, because not only is that good for your physical health, it's also good for your mental health as well. And so really it's looking at the patient as a whole person. They're inside, they're outside, and everything in between to make sure that you can be the best that you can be.
Yeah, and the inside outside best you can be, but also to that analogy can be used for also one. And the other thing I want to talk about here as well, mental health also being part of brain health as well. And I mean, Alzheimer's is a thing, dementia is a thing, but I don't think those are the only things people need to be worried about that are on that list when it comes to their brain health. Can you talk a little bit more about that? I guess in the physical sense.
So really in the physical sense, there's normal aging. Everything tends to slow down a little bit. We're not as springy or stretchy as what we were when we were in our 20s. And so because of that, we're hesitant to say, hey, I'm actually slowing down, because it makes you feel like less of a man or less of a provider, all those stereotypes that have kind of beaten in our heads since an early age. So the important thing is to, it's okay to have a little memory slip out. It's okay to be able to have to write yourself notes. It's okay to be able to do all those things. When it becomes an issue is whenever you're not just getting tired, you're truly weak. It's not that I can't I can't bench press 120 pounds. It's I have problems picking up the 5-pound can of tomatoes, things like that. And so really it becomes a neuromuscular issue is what we tend to notice as we get older, the memory issues that go along with dementia. And especially it's important as we go through our life. The main cause of dementia in men is actually a vascular dementia. So going back to the blood vessels with heart attacks and strokes. And that's why it's so important to take care of all of those pipes going throughout your body and keep them as healthy as what you can throughout your lifespan. So that way there's not damage done when you're older. And that way you can still be as sharp as what you were when you were in your 30s.
All right. Thank you so much. And Dr. Ryan with Piedmont Medical Center. Thank you so much for joining us here, Queen City News Plus.